It's Dr. McQuillan from Berkshire Menopause Clinic, and I'm going to be talking about the different types of intrauterine coils and what they are used for. So let's begin. So we have non-hormonal coils and hormonal coils. Let's start with non-hormonal coils. So non-hormonal coils, for example, this one, are copper coils. You can get 5 years or 10 years, and they are used for contraception. Whether you choose 5 years or 10 years depends on whether or not how long you want to use it for contraception. One thing to note though, if you do go for a 10-year one, that does not mean you cannot have it taken out early if you want to try and conceive again. And then your period or your fertility will go back to what's normal for you pretty much straight away, but it may take a couple of cycles just because everyone is individual. Now, with the non-hormonal coil, your periods will tend to be doing what is natural for you. What I do tell some women though, is it can make your periods heavier. So if you already suffer from very heavy periods, then it is important to know that because it may make them heavier and you may not choose to use that for your contraceptive choice. Then we have hormonal coils, and there are lots of different types, and I'm going to go through them in different categories. The first category is high dose progestogen coils. Now these are your Mirena coils, your Levocert and your Benelixir. These three can be used as part of HRT for your endometrial, your womb protection as part of HRT, because if we gave estrogen alone, it can thicken your womb lining. So we need progestogen in anyone with a womb. And so these three can be used for that. They can be used for up to 5 years as part of endometrial protection for HRT. They can also be used for contraception. It's important to know that they, under the age of 45, can be used for 8 years. So the guidance for Mirena coils have now changed from 5 years to 8 years under the age of 45. And over the age of 45 can be used until menopause as part of contraception. And then the third use, which you may commonly know the Mirena to be used for, is part of bleeding disorders. And this is things like if you've got heavy periods, if you've got things like endometriosis, then they are a good treatment for that. That is the high dose progestogens. You can then get lower dose progestogens, and these are things like the Kyleena. Kyleena can be used as part of contraception for 5 years. The difference between the Mirena and the Kyleena is its lower dose, but it is also slightly smaller. So if, for example, you've not had children vaginally, your cervix has never been dilated, you may want to use this type. Now, it is not used for bleeding disorders, but I may say that a lot of my patients do report that their bleeding is often lighter. Another form of hormonal type of coils is the JDES. The JDES lasts for 3 years and again is used for contraception. It is again lower dose, and it is not used for HRT, and it is not used for bleeding disorders. You may experience with the JDES some improvement to your bleeding disorders, but it's not advertised for that. But again, you may be somebody who's lucky whose periods get less so. How does a coil sit? I'm just going to demonstrate. So I do have a womb here, but I've actually got a model which I use. So what happens at the procedure? You might find this is the instrument that is used. You will have a speculum examination as you normally do, where your cervix is visualized. So doctor will do a vaginal examination, put a speculum in to visualize your cervix. Then this instrument is used. And what happens? The instrument is used and gently it is used to lever up the coil, which then sits in your womb in here. And it sits for the number of years that I've discussed. It is important to know the main side effects if you're having hormonal types of coils can be changes to your bleeding pattern for the first 3 to 6 months. Then most people it settles, or if you're using the lower dose, it goes back to what your normal periods would be for you. If you're using the higher dose, a lot of people report no periods or a lot lighter periods. And as I said before, if you're having non-hormonal, it may increase your bleeding for your periods, but it shouldn't disrupt your periods with having lots of hormonal changes because there are no hormones contained in there. The other thing that I didn't mention about non-hormonal, so the copper coils, they can also be used as part of emergency contraception. So it's important to know that, because you may be using that as part of emergency contraception, but then it can be still used long-term as part of ongoing contraception as well. I hope that helps.